Hello. Again, my name is Dr. Mike Denninger. I'm the creator of Multichannel Eye Movement Integration. And we're here for the second podcast interview that I'm doing related to individuals who have taken the multi-channel eye movement integration training and have implemented the technique into their practices. So we're really honored to be joined today by Dr. Carolyn Prince. Dr. Prince is a licensed naturopathic doctor. She is also a licensed professional counselor. So she brings two skills to this effort, and I want to congratulate her on her achievements, first of all, but also welcome you to this podcast, Carolyn.
Thank you. Thank you for having me. Thank you for the invitation. I was looking forward to this.
Good, good. So, like I said in the first podcast, I like to be transparent. So I will tell you that Carolyn and I have had conversations before. When she took the MEMI training, she took it online and she took it through the Arizona Trauma Institute. And she and I did the coaching that's required for people to become certified in the therapy after they take the course. So Carolyn, why don't you tell the audience a little bit about how you came to find this course and what that journey was like for you?
Yeah. So I was looking to hone my skills around trauma work. I had an intention to become a specialist or an expert in trauma work. And so MEMI came across into my inbox. And so I signed up for the course when that happened. And so it was offered during the time of the pandemic, the lockdown. I think we were just coming out of the lockdown. And so the option to do it online, I chose that option. Previously, I had been basic trained in EMDR, and I am familiar with that modality. I'm using that with my patients. So that they were experiencing some level of impairment in their daily lives. So I was looking to see how what other modalities I can get in my toolbox to help resolve trauma. So I took this opportunity.
Oh, wow. That's great. Had you taken other courses from the Trauma Institute, or was that the only one?
I think yours was the first.
Okay.
MEMI was the first, yeah.
Okay. Now, I did mention that you were both a naturopathic doctor
Yeah.
and a licensed counselor. So if you could, tell us about your training and what the difference is between, say, a naturopath and a naturopathic doctor.
Yeah, it can be confusing sometimes to the
Mhm.
general public. Yeah, so I graduated with my master's in counseling and had been doing this work for some time. And then I went to medical school, and during the clinical portion of my medical training, when I was interfacing with patients coming in for some physical chief complaint and discussing their concerns, there was always, or it seemed to me that there was always mental, emotional peace that was impacting their physical concerns. And that could be a function, of my perspective of my training as a counselor. But nonetheless, what it did for me, it reinforced the perspective that people aren't just physical bodies. So I have a belief that we have a mental, emotional part of our being, our soul, and we have a spirit, and each aspect doesn't start at a discrete point and end at another discrete point, but it flows, and oftentimes it impacts, our bodies. So it became, to me, a thing that I wanted to integrate mental health strategies with medicine, and more specifically, naturopathic medicine. So a naturopathic doctor is a licensed physician. We are trained as PCPs, and we complete the legal and the academic requirements, including attending an accredited institution. We study, sit, and pass our state boards. before we become licensed to practice as a doctor. So some naturopathic physicians often would refer to themselves as naturopaths. And there are others who might have taken, a course online, but did not go through the rigor, let's say, of medical school or the legal requirements and can refer to themselves as naturopaths. So, but a naturopathic doctor can refer to themselves as naturopath, but a naturopath cannot say that they are a naturopathic physician or a naturopathic doctor because it's a legally protected term.
Hmm.
So it can be a bit confusing to
Hmm.
the public.
So if somebody is interested in naturopathic medicine and they want to make sure that they find a doctor or a physician who's been trained, then they're going to look at their background and training. Is that
Yeah.
right?
Yes. Yeah.
Okay. Wow. So I imagine that when you get a new patient come in, that you're looking at both sides, right? You're
Yes.
looking at the
It's
physical,
important to do that.
the mental
Yes.
health aspect. How do you do that?
Yeah. So I have to assess the physical aspect of their concerns. So initially, I would assess, for example, somebody comes in with depression and or anxiety for example, I would need to assess if there is any physical things going on in their thyroid glands, in their endocrine system, hormonal system, and check that to make sure that things are functioning normally before I would um, assess if the mental emotional aspect is literally that alone and not necessarily um, the physical that is impacting.
Okay, that makes sense to me. It's what counselors do too, but they have to
Yeah.
refer out for the medical aspect.
Right, right.
You're like one-stop shopping.
The idea is the integration. So
Uh,
that's the goal of it, to integrate both aspects of that. Yeah.
wow.
Yeah. So one-stop shop, hopefully.
That's great. So tell us a little bit about yourself. We like to get a sense of a person's roots and, what shaped them as an individual as they were coming up in the world. What can you tell us about you?
Yeah, I think as a young girl, it started, I believe, as long as I can remember as a little girl, adults would confide in me and share things that were beyond my capacity at that time to help. But I found it just natural to support individuals. So my decision to explore psychology and counseling just seemed to be the next step. In reference to naturopathic medicine, however, my youngest sister became ill,
Huh?
and we were looking for ways to help her heal. And we were exploring other approaches to medicine that is not just the conventional or allopathic medicine. Because we don't think that the body was lacking of a drug, but we needed to find out what is the root cause. So as I was exploring and researching ways naturopathic medicine came into my purview, and it resonated with a deep part of me that I would, was in an authentic way, it resonated. And so I was pursuing that. And so now the integration of naturopathic medicine and mental health is my life's work, to bring them both together so that we can address what is, someone coming before us.
Well, that certainly is a heartwarming story, the way you got started.
Yeah.
That's wonderful. Um, so now that we have an idea about how you got to this place personally, tell us a little bit about the clients in your practice. In a typical week, what kinds of people would you see and what would your approach be?
Yeah. So integrative mental health zone, that's my practice. I consider it to be a place where I integrate the healing modalities of naturopathic medicine and the strategies in mental health counseling. So I generally tend to attract adults in their mid-30s or so
Huh?
who have established careers and are having, a difficult time or stressful time navigating their lives. And in one way or another, it is related to past unresolved trauma that has, transpired decades earlier, oftentimes in their pre-verbal single-digit childhood years, but it finally shows up as some maladaptive or dysfunctional way in their lives, in their relationship to themselves or the relationship with other individuals, significant other individuals. And so I generally tend to see people who come on the spectrum of anxiety, depression, panic disorder, PTSD, low-grade depression, postpartum anxiety, though that is rare, but it happens, stress, grief issues, complicated grief, relationship issues, self-esteem issues that are negatively impacting their lives.
Okay.
So, yeah, and impairing their functioning. So, in terms of the individuals and their functioning, I work with medical doctors, dentists, university professors, therapists, housewives, veterans in active duty. So, there isn't one theme. So,
Okay. Wow. So you've already mentioned now that you see a good number of people who have some form of trauma.
yeah.
It could be historical, it could be a recent event, I assume, like you mentioned, it could be postpartum. What is your approach to kind of regulating the body again? How do you, once you get down to that trauma work and you see the anxiety and you can see the sensory systems all, garbled and out of whack, what is your first line approach?
Yeah. So, when patients come, they're generally familiar with EMDR. So it's in the zeitgeist. Most people are familiar with trauma work and they're associated with EMDR.
Mhm.
So I take the opportunity to teach how eye movements and trauma processing can help reduce the negative charge of unresolved trauma. And so I introduce MEMI. So I do lots of psychoeducation and I teach about MEMI. So I also let them know that I'm trained both in trained in EMDR and certified in MEMI as a result, and look to other results that I've seen with other patients and how that is just simply outstanding in terms of patients' self-reports. And so that helps an individual come in to know that the work that they're about to engage in, there is scientific underpinnings in as much as there are positive clinical results. But to answer your question more directly, I use MEMI because the results that clients have reported, when I have used EMDR in the past, what I've noticed was I would get, I would see results, or clients would actually self-report that they're getting a shift, but that would occur over several sessions, over several weeks. And I wanted for my patients to experience the breakthrough that I know trauma work processing can happen, for them as well. And so the time it took to get a shift using EMDR and when I started using MEMI was simply miraculous, was simply outstanding. And so with MEMI, I do not need for them to rehearse their traumatic event. With EMDR, oftentimes that might be the case. But even if there are a client is re-traumatized in the instance if I'm using EMDR. When I use the EMDR, we would ground them and to make sure that they are mentally stabilized again. But it was during this time with my work with MEMI, I started sending you emails that of the results that I'm seeing. And I didn't realize my expectation was that I thought this is going to take several sessions again before I can actually see a shift. And so when I did the first set, when I introduced the MEMI into my practice and I had my first patient with using MEMI, I did the first set, and as I was assessing if anything changed, I noticed that, there was a quizzical look on my patient's face. And I was taken aback because I didn't understand how quickly that a change could have occurred. And I thought that perhaps was just an anomaly or a one-off, but it kept happening. And that's when I started sending you emails and my interest to become certified in this modality and recognizing how beneficial this is in my practice.
That is something that's very common especially among therapists who have been trained in EMDR and make the switch to MEMI. That number one, it takes longer.
Yeah.
Number two, if I remember your words correctly, I should tell the audience that Carolyn also wrote a testimonial that appears on our MEMI website. And what she wrote in that testimonial was she was blown away. So
Yeah.
tell us how you were blown away.
Yeah, it's the time that it took. So oftentimes, like one of the differences with EMDR and MEMI, apart from the linear eye movement, horizontal eye movement, MEMI takes in the four quadrant of the visual field. And so working with this patient was not the patient who would want to impress, their doctor with words. And I just saw that look that this is weird. And I've had patients say that this is weird. How is it I can't recall
This is
this?
weird.
Yeah,
Yeah.
and there were other times with other patients after we have done some real deep work from their traumatic history, they would come and say, "Can we do that eye thing again?" because they realized how it was beneficial for them. So I was really blown away because it wasn't just a one-off incidental anomaly, but it kept happening consistently. And this is not something that I am presupposing on the patient's reports. They initiate telling me that the change that has occurred, you know?
So I this is a question that I'm always curious about. For someone who is EMDR trained and you used EMDR for some period of time as a frontline approach, correct?
Yes.
Okay. What do you imagine the difference is between EMDR and MEMI that allows the results to take place so quickly?
I almost think of it encompassing the four quadrants of the visual field as opposed to just the horizontal or even the oblique. And so encompassing that and the reversal of those eye movements, I think it's really, so the way that I explain it to clients, I don't get into the scientific aspect of it. But I explain the way trauma is reinforced and how a memory is reinforced in our lives, particularly maladaptive or dysfunctional or traumatic memories, and that our eyes are connected to our brains. I think of our eyes as the external parts of our brain. And there's something that can happen with our eyes and regulating our eye movements that has a way of doing some deep subconscious work. And so the change in which occurs, the speed in which it occurs, is just it's just evident that it's different from using EMDR, that it would take several sessions.
What is MEMI's role in a counseling approach? I imagine you don't use it every day,
Yeah,
correct?
not with every client too. So you'll have to assess that, but that is the trauma processing tool that I use. But I think in the clinical field, I think it's awakening to how trauma changes our psyche and how that changes can show up as some caricature of ourselves. And so not getting to the root issue is just like spinning top in mud. You're going around that vortex yet another time. I think there's value in talk therapy and psychotherapy, but if there is a trauma bedrock, that has to be addressed for there to be significant change. So yeah, I foresee a time that MEMI would be part of traditional academic training. Like I was first introduced to EMDR in my medical training. I did a selective course in naturopathic medicine and mental health, and that's when I was introduced to EMDR. And I sought additional training to become more focused, in that type of work. So I do see that it can become part of our academic training since it is such a vital piece of that would augment our work
Mhm.
and in a deeper and richer way.
Well, we are certainly open to talking to the physicians and the medical trainers who are
Yeah.
anywhere and everywhere. So I wanted to ask you now, before we finish, I always ask two questions. And the first question is for the new students who are coming to you. Let's say you go and you lecture to a graduate class in trauma therapy, and it's a mental health training program. What do you say to them about what's important for them once they get out and start working with clients?
I generally think that they do their own work as a young therapist coming into the field. It would behoove them to get counseling for themselves to address their own trauma profile and to look for a MEMI trained therapist to do that personal work. And to, when they're getting their CEUs or even their CMEs, to expand their training to include MEMI.
Okay. Now I was just thinking that we did the coaching together. And
Yeah,
one of the things that I always do when I coach a person and they're going for a certification in MEMI is I do a MEMI session with them.
right.
And I imagine, but I don't remember, we did a MEMI session. You don't have to tell me any of the content or anything, but what was your experience like going through MEMI yourself?
Yeah. So while we were training, you had led these participants through an exercise. And I think you started by saying for each individual to pick some trauma in their history. And you did that as an exercise. So as a group, you did that.
Oh,
And that's when I did that as a group. So individually, I was going through my own issue. And I used that. And you were doing the eye movements, and this was online, but you were doing it in class with those who were present. And I experienced that shift. And while we did our coaching for supervision for my certification, I also raised an issue, and an issue that has, haunted me. And I was able to have that diluted, as it were, the negative energy around it dissolve. I almost think of it like fog on, a triple digit hot summer day that just disappears. So I remember the memory and the image, I remember it, but it doesn't have that same sticky hold on me. So experiencing it myself, I see how my patients also get benefit from their issues as well.
That's great. So it went from 100 degrees down to something much cooler, huh?
Yes. So not triple digits, but much cooler. And you can look at that and relate to it in a way. So it's a real significant change. So it's not like we are competing with the modalities, but when you recognize something works and you've seen it, it's not a textbook or somebody's trying to convince you about something, but you actually see it with patients. Like that really makes your work rewarding, as opposed to the frustration of waiting for the shift to occur. It happens and you can't just explain it away that it was a coincidence or it was a random. It was too consistent that, so it's worked. So I have a vision for MEMI of if you know that, in hostile parts of our world where people go in to help the Red Cross or Doctors Without Borders and stuff, that there will be MEMI without borders. So maybe that's not the best appealing way, but MEMI trained clinicians will be in those settings. And so like when I continue to do my work, like in my retreats, MEMI is a significant part of that. So apart from the physical aspect of it, each participant will get a MEMI session, trained in it because it's such an integral part of our lives.
Oh, wow.
It has to be part. So both your physical and your emotional,
Okay.
restoration is occurring.
You're talking about retreats that you lead?
Yes, that I host that. So it would be naturopathic integration, medicine integration with mental health, but the mental health portion, or that to have a holistic, restorative, replenishing, refreshing time is not just resting. You have to address that thing that dogs you for decades, And so, yeah, that's a significant part of what it would mean to have a successful retreat.
Oh, that's great. That's really wonderful. I wanted to just allow you now, if you want to add anything here at the end that you think is important about MEMI or about anything before we finish.
Yeah, I believe patients can take responsibility for their own health, physical and emotional, and the clinician comes alongside to help them heal. And trusting that the work that we do and getting the training that we have and honing our skills is hugely important to expand the base on which this therapeutic modality can really benefit people and clinicians, patients and clinicians alike. So I'm looking forward to becoming a trainer. I think I was one of the first who became certified. I was so impressed with MEMI because it's such a young field. So I'm looking forward to the next steps. And I've been sending emails and saying, when are you going to do another training? When is it? What is the next step beyond certification? What do I need to do? What's it? And I think you've been saying to me, hang on, Carolyn, it's coming. But yeah, so I look forward to that time. And I think that time is sooner than later in terms of bringing people on board to.
Yes, we've certainly come a long way in 2 years, and it's been a wonderful journey, and it's been wonderful for me to have you along.
Yeah.
I remember you telling me that you were the first to get certified, and telling me before you did that that you wanted to be the first to get certified, and then you did.
Yeah, it was a process. It really was a process. But there was, have these steps, and I think it's incumbent for clinicians to hone their skills and to get the training beyond postgraduate to do that. And so I really want to do that, because I think some clinicians might be frustrated in the sense of how long it takes. And I've always had an issue with the years it takes in therapy. So I say to my patients, I am here to, at the end, you can thrive, you can succeed, and you don't need me. Otherwise, I wouldn't have done my work well. And so just like an eagle would, push that eaglet out, eventually the eaglet will learn to use its wings. So to navigate their life, they're able to stabilize themselves. They know what to do because um, it's they need to know how to take their healing into their hands. I believe healing is available, and clinicians can come alongside patients, and together we can do good work in this world.
Mhm. Awesome. Well, thank you very much for joining me on the second podcast, Carolyn. And for the audience out there, this brings this podcast to a conclusion, and we'll look forward to many more. Have a
Yeah.
wonderful day and a wonderful experience out there.
Thank you.
Bye-bye now.
Bye-bye.